The nurse is observing the fetal monitoring strip of a 37-week-old fetus. He observes a visually apparent and abrupt increase in fetal heart rate, FHR, from a baseline of 140 to a peak of 159. The FHR returns to baseline after 20 seconds. What type of fetal heart rate characteristic has occurred? A. Deceleration. B. Recurrent acceleration. C. Prolonged acceleration. D. Acceleration. E. Tachycardia. The answer is D. Acceleration. An acceleration in fetal heart rate is defined as a visually apparent and abrupt increase in FHR, where the FHR increases from the onset of the acceleration to the peak in less than 30 seconds. At less than 32 weeks, the acceleration must peak at least 10 bpm above baseline and last at least 10 seconds. At more than 32 weeks, the acceleration must peak at least 15 bpm above baseline and last at least 15 seconds. A prolonged acceleration follows the same guidelines as an acceleration, but lasts more than 2 minutes and is not longer than 10 minutes in duration. After 10 minutes, it is a change in baseline FHR. A deceleration is a visually apparent decrease in FHR from the baseline, gradual or abrupt, that returns to the original baseline. Recurrent accelerations occur with more than 50% of contracts in any 20-minute window. Tachycardia is a baseline FHR of more than 160 bpm. The nurse observes an electronic fetal monitoring strip. Upon review, the fetal heart rate, FHR, undulates from 140 bpm to 160 bpm and back down to 140 bpm in a consistent cycle over a period of 35 minutes. What type of fetal heart rate characteristic is occurring on this electronic fetal monitoring strip? A. Intermittent. B. Variable. C. Bradycardia. D. Recurrent. E. Sinusoidal. The answer is E. Sinusoidal. A sinusoidal pattern is a visually apparent, smooth, sine wave-like undulating pattern in fetal heart rate baseline with a cycle frequency of at least 3 to 5 minutes that persists for more than 20 minutes. Variable describes an abrupt deceleration of visually apparent decrease and return in fetal heart rate, FHR, from baseline lasting less than 30 seconds. Bradycardia occurs when the baseline FHR is less than 110 bpm. Intermittent describes an acceleration or deceleration occurring with less than 50% of contractions in any 20-minute window. Recurrent describes an acceleration or deceleration occurring with more than 50% of contractions in any 20-minute window. In a fetus positioned at left occiput anterior, LOA, where should the nurse assess the fetal heart rate, FHR? A. Above umbilicus on mother's right side. B. Below umbilicus on mother's right side. C. Above umbilicus on mother's left side. D. Below umbilicus on mother's left side. E. At level of umbilicus. The answer is D. Below umbilicus on mother's left side. When considering where to hear fetal heart rate best, the nurse must consider the location of the fetal back. Weeks gestation or size may also affect the location of the best place to assess fetal heart rate. LOA, or left occiput anterior, is the most common fetal lie. A fetus in LOA is in vertex presentation with the fetal occiput on the mother's left side toward the front of her pelvis. In LOA, the FHR is best heard below the umbilicus on the mother's left side. In LOP, left occiput posterior, the FHR is best heard on the mother's left side at the level of the umbilicus. In ROA, right occiput anterior, the mother's right side below the umbilicus. In ROP, right occiput posterior, the mother's right side at the level of the umbilicus. In LSA, left sacrum anterior, the mother's left side above the umbilicus. In RSA, right sacrum anterior, the mother's right side above the umbilicus. What is the triad of presenting symptoms with endometriosis? A. Dysmenorrhea, infertility, and dyspareunia. B. Dysmenorrhea, metorrhagia, and dysuria. C. Hirsutism, infertility, and oligomenorrhea. D. Menorrhagia, infertility, and dyspareunia. The answer is A. Dysmenorrhea, infertility, and dyspareunia. The triad of presenting symptoms for endometriosis is dysmenorrhea, painful menses, infertility, and dyspareunia, pain on sexual intercourse. The most common presenting symptom is extreme, intense uterine cramps which may radiate to the back or down the thighs. Endometriosis is also a common cause of infertility due to a local paracrine effect. Pain on intercourse may be due to the implantation of endometrial cells in the vagina or the area around the cervix. Endometriosis will not necessarily result in menorrhagia, or excessively heavy bleeding. Hirsutism, infertility, and oligomenorrhea are symptoms commonly seen in polycystic ovarian syndrome, PCOS, rather than endometriosis. Which of the following increase the risk of endometriosis? A. Lack of exercise. B. Presence of an intrauterine device, IUD. C. Family history of endometriosis. D. All of these are correct. The answer is D. All of these are correct. The incidence of endometriosis increases significantly in individuals with a family history of the condition. Other contributing factors are sedentary lifestyle, lack of exercise, presence of an intrauterine device, a diet high in fat, the presence of estrogen dominance, and liver dysfunction, due to decreased estrogen metabolism.